Today is real. The dream is real.
The amount of resiliency and patience and persistence that this represents, not just of Chris, but of many of you here today. When you have dreams and you wake up, you want to make them come true.
When we moved to Presbyterian, that was a private hospital.
Somebody, an architect back in the 70s, had the idea to build old Presbyterian OU Medical Center like a hotel.
I came to this campus in 1989, and the infrastructure, well, shall we say, was lacking.
When I started college here on campus, it was actually 1993, because I spent my first 2 years on the Norman campus and then came up here for the last 2 years with nursing school. And it looked so different. We spent a lot more time in the tunnels back then.
In 1998, the campus was pretty woefully undercapitalized. Buildings were old, our equipment was old.
Emergency department was so cramped. It was kind of nice because you could be having two patients fairly close to each other and manage them together, and the nurses could just turn around and grab something and it was right at their hip or things like that. But it was a challenge those early days.
It was an incredible space for us to come to and join all of our services, but over time we had outgrown it. It didn't really have space for teams to round or learning and education to happen.
The University Hospitals Trust, under the new joint operating agreement, had constructed the new OU Physicians Tower. So that was the first major investment of the trust here on campus.
And we now have a world-class facility.
We've seen a lot of growth over the past few decades. New outpatient facilities, Stevenson Cancer Center, D. McGee Eye Institute. But we really haven't seen that expansion of the inpatient hospital system to match.
Because we've tried to adapt it over time to the growth and the changes in healthcare, it's a difficult experience to provide care in. It's a difficult experience to maneuver as a patient or family member. There were obviously things that were done incredibly well for what healthcare was at the time that the building was built. But over time, that became not what was meeting the needs of patients and families. Families became much more involved in healthcare and spending time with the patient.
Credit to the team, because we've made it into something we can do great work in, and it will still be there for us